Brothers, prostate cancer hits black men harder. We're more likely to get it and more likely to die from it, mainly because it often shows no symptoms early and gets found late. The good news is we can catch trouble early with a simple blood test called PSA. PSA doesn't mean you have cancer, it's an early warning signal. PSA can go up for non-cancer reasons too, like an enlarged prostate or inflammation. If you're a black man, don't wait until you feel something. Many experts recommend a baseline PSA in your early 40s, or at least start the conversation by 45, sooner if prostate cancer runs in your family. This is about staying here for your people. Ask your doctor for a PSA discussion and make a plan you understand. Q&A. Cheat sheet. Quick facts. What is PSA? A blood test that measures prostate-specific antigen, PSA, a protein made by prostate tissue. Why it matters? Early prostate cancer often has no symptoms, so screening is about finding it before it spreads. That's when it's most treatable. When to start talking about screening black men. OBAS line, PSA, age 40-45 for men at increased risk, includes black ancestry. OH 45 is a common start the conversation age for black men in major guidance, earlier with stronger family history. Myths about PSA and the truth. Myth 1. PSA is a prostate cancer test. Truth. PSA is a risk signal, not a cancer only test. PSA can rise from BPH, enlarged prostate, or prostatitis, inflammation, infection. Myth 2. High PSA means I have cancer. Truth. Not necessarily. High PSA usually means follow-up. Repeat PSA, other tests, sometimes MRI, to figure out why it's high. Myth 3. Normal PSA means I'm safe. Truth. PSA can miss some cancers. That's why doctors look at trends over time and your risk factors, not a single number. Myth 4. If they find prostate cancer, I'm automatically getting surgery. Truth. Many prostate cancers are slow growing and may be managed with active surveillance, close monitoring, instead of immediate treatment, depending on risk level. Myth 5. PSA screening is always good. PSA screening is useless. Truth. It's a trade-off. Screening can prevent some deaths, but it can also cause false alarms, extra procedures, and overdiagnosis. That's why guidelines emphasize a shared decision, what PSA can do versus can't do. PSA can flag that something may be going on with the prostate early, help decide who needs closer evaluation. Repeat PSA, imaging, urology visit. PSA can't tell you for sure whether you have cancer, it's not definitive. Tell you for sure whether a cancer is dangerous by itself. That comes from the full workup. How to talk to your doctor. Start the conversation. I'm a black man and I want a plan for prostate cancer screening. What age should I start and how often? Make it personal. Risk check. My family history is dad, brother, uncle, age diagnosed. Does that change when I start? Ask what the next step would be. If my PSA is high, what happens next repeat test? MRI or urology? Ask about harms so you're informed. What are the risks of false positives, biopsy, and overtreatment? Ask what might affect PSA. Do I have anything that could raise PSA besides cancer, BPH, or inflammation? Any medications that could lower it? If your PSA comes back high, what you should expect, typical path 1, don't panic. PSA can be elevated for non-cancer reasons. 2. Repeat PSA or check related measures and your risk factors. 3. If concern remains, your clinician may refer you to urology and consider imaging and/or biopsy. Biopsy has risks. Simple starting age guidance you can post on a sign. Black men. Ask about a baseline PSA at 40-45. If family history is strong, start earlier and be more proactive. Age 70 plus. Routine screening is often not recommended. Decide based on overall health and a doctor conversation. And as always, may the rest of your life be the best of your life. Oranz.